Next, we have Ellen Demlow. For the past 4 years, Ellen has worked as a regional epidemiologist at Vancouver Coastal Health. Her primary focus has been HIV STIs, including program evaluation for the regional Stop HIV/AIDS project. Welcome, Ellen.
And can I play with this a little bit? Does this get bigger? Oh, okay, perfect.
Awesome.
And then this is next slide. Great. Well, on behalf of my co-authors, I'd like to thank the Community-Based Research Center for inviting us here to speak today. And I'll be talking about our community health profile that we built using My Health, My Community data, which was a survey that I'll discuss moving in a little bit. So I don't think this is any news to the people in the room, but the LGBT population represents a diverse population, obviously across all ages, genders, geographies, and ethnicities. But what is shared are common experiences of structural and social stigma and discrimination that can contribute to worse health outcomes, adverse health behaviors, as well as unequal access to safe and competent health care. And we know that this can lead to a variety of documented health disparities compared to their non-LGBT counterparts that include higher odds of disability, mental illness, adverse chronic health conditions, as well as experiences of violence and victimization. So our aim with our community health profile is to better understand the health of the LGBT community in the geographies of Vancouver Coastal Health and Fraser Health Authorities, so essentially the lower mainland area. And what we want to do is identify both gaps as well as strengths to inform our community health programming moving forward. So a little bit about My Health, My Community. So this was a survey that asked questions that span the scope of health for people who live in the lower mainland. So we asked questions about socio-demographics, health status, including chronic health conditions, lifestyle, healthcare access, so primary care access within the lower mainland, all the way into your built environment. Do you feel safe in your neighborhood? As well as indicators of community resiliency. So data was collected from My Health, My Community from 2013 to 2014, and this was in partnership with the two health authorities as well as with our colleagues at UBC. This was, the age for survey respondents was over the age of 18 years, and we did a lot of different types of promotions, predominantly online, including media, I guess not online, would be like newspapers, as well as social media promotions and outreach. And our goal for My Health, My Community was to achieve a sample size of 2% of the lower mainland population. And that represents about 43,000 individuals that we hope to survey. And we use purposeful sampling or quota-based sampling. So basically what we did is we divided up the lower mainland into neighborhoods, divided that up by age and gender categories so that we could try to meet those numbers of individuals to hit, just so that we had, men aged 20 to 24 in Kitsilano, for example. And if we found that we did ongoing monitoring of progress so that we could determine areas to focus more resources to get a better representative population. And then also to increase representativeness, we did post-collection weighting by age, sex, geography, and education. So in total, we were able to achieve 33,000 survey respondents, so about 75% of our goal. And this is a map that shows all of the areas where we did active surveying. And the darker green are the areas where we did meet our goal of 2% or more. And then some of the other areas where it's a little bit lighter, areas where we obviously need to do a little bit more work for round two. But I think in total, it's a pretty representative survey. So the method specifically then for the LGBT profile. So we limited our study population to people who self-identified as heterosexual or straight, gay or lesbian, bisexual, or transgender. And of course then LGBT was then further defined as those individuals who self-identified as lesbian or gay, bisexual, or transgender. And for population projections, we used BC stats from 2013 to 2014. And again, just with the survey methodology, all measurements are already weighted. And then we also made odds ratios using multivariable logistic regression with further adjustment then for gender, age, ethnicity, as well as income. So just to dive straight in, we surveyed about 1,600 people who identified as LGBT. And we estimate that that represents about 5.7% of the total survey region. And we think that that could potentially be up to 133,000 individuals aged 18 years or older. And when we look at gender identity, for example, for female, we estimate that 1.6% of respondents identified as lesbian, 2.2% as bisexual. When we look at male, we estimate that about 5.8% identified as gay and 1.5% bisexual. Transgender, here we're starting to get into smaller numbers, but about 18% identifying as lesbian or gay, 6.3% bisexual, and about 39% heterosexual. Although it is important to note that about 1/3 of our transgender respondents did not disclose a sexual identity on the survey. So here we're looking at I'll show you two maps that essentially show the distribution of the LGBT community in our area. The first one looks at the proportion of the local population that identified as LGBT in our survey. So for example, when we look at the darkest area, we're looking at Vancouver City Centre, where about 25% of the population identified as LGBT. That was followed by about 12% or 15%, for example, in the downtown east side. When we look then at Vancouver overall, that's about 12% of the Vancouver population identifying as LGBT. So the second map is basically showing the distribution of people who identify as LGBT. So again, Vancouver City Centre, about 21% of people in our survey region who identify live in that region, and about 53%, I think I said that earlier. I apologize. And about 12% of the LGBT population live in Surrey. So this just gives you an idea of some of the distribution throughout our survey region. So getting right into demographics, here we're looking at age category on the top and ethnicity on the bottom. And LGBT respondents were significantly more likely to be younger than non-LGBT counterparts, as well as significantly more Caucasian, as well as Aboriginal respondents identified as LGBT, and significantly fewer Chinese respondents identified as LGBT. This graph here looks at some of our socioeconomic indicators. And so here we're breaking things up a bit, where we have gay and lesbian respondents in darker blue, bisexual in green, transgender in purple, and heterosexual in a bright cyan, I guess is what we chose. And along the bottom is some of our socioeconomic indicators. So for example, when we look at far left here, we're looking at individuals who have a high school education or less. And we see that gay and lesbian respondents had the lowest proportion of individuals with the high school education or less, followed by our bisexual and transgender respondents with a higher proportion. Although it is important to note that those weren't significantly different compared to heterosexual. When we look at household income less than $40,000, we see that gay and lesbian as well as heterosexual respondents had the lowest proportion of households with an income of less than $40,000, while bisexual and transgender households were significantly more likely to fall into that income bracket. When we look at currently employed, gay and lesbian respondents had the significantly highest proportion of current employment compared to all other sexual as well gender identities. And when we look at born in Canada, we find that LGBT respondents were more likely to be born in Canada compared to their non-LGBT or heterosexual counterpart. Looking at some of the lifestyle factors. So here we have physical activity followed by nutrition. And we saw no significant difference comparing the two populations for both physical activity and nutrition. But when we do look at some adverse health behaviors, and this figure specifically looking at smoking, we do see that there are higher rates by age category for LGBT respondents. And those rates are significantly higher among younger LGBT aged 18 to 39. And also when we look at frequent binge drinking by age category, I think it's positive that we do see a declining trend over time by age, although for LGBT age 30 to 39, that is a significantly higher proportion. So now we're going to get into some primary care access. LGBT respondents were more likely to visit a healthcare provider in the past 12 months, but they were significantly less likely to have a family doctor or visit that appointment or physician with an appointment. So there might be some access to care barriers. Looking now at health status. So there's kind of a lot going on in this graph, so I'll sort of walk us through it. But what we're looking at here are odds ratios for health status, including chronic disease as well as general health and mental health. So we're looking here in blue, gay and lesbian respondents compared to heterosexual, and green, bisexual respondents compared to heterosexual. And any bar that's going to be to the right is an adverse association, and any bar to the left would be protective. And you can see the confidence interval as well, and if that crosses 1, then it's an insignificant association. So just to walk you through this one, we'll do it together. When we look at poor or fair general health, we do notice that there is no significant difference between gay and bisexual respondents with their heterosexual counterparts, but we do see that bisexual respondents were significantly more likely to indicate poor or fair general health, and almost 2 times as likely compared to heterosexual respondents. When we look at mental health, again, poor or fair self-disclosed mental health, we see no significant difference among gay and lesbian respondents, but we do see a significant difference among bisexual respondents, and again, almost 2 times the odds of reporting poor or fair mental health. Moving down into obesity, we do see no significant difference in each group. However, we'll revisit this shortly because we do see gender differences that we can talk about. With diabetes, it does look like there is a potential protective effect with gay and lesbian respondents. It is just barely insignificant, so it might represent a trend. But with bisexual respondents, we do see an adverse association with diabetes, and that approach is almost 3 times as likely of reporting diabetes compared to heterosexual respondents. With high blood pressure, we saw no difference. And with heart disease, again, we are seeing bisexual respondents having significantly higher odds of reporting heart disease. We're almost through this. With chronic breathing condition, both gay and lesbian respondents as well as bisexual respondents were significantly more likely to report a chronic breathing condition. And I found this one to be particularly interesting because it's relatively consistent with the literature when we look at asthma reporting in the LGBT population. We don't know what chronic breathing conditions are implicated here, but it is an interesting trend that we do see as consistent. With arthritis, we saw no significant difference. And again, with mood and anxiety disorder, and I think this one's been talked about a little bit today as well, we do see significant associations for both sexual minorities, with bisexual respondents having higher odds. So that was a lot. So now we're going to look at a few of these in a couple different ways. So this is looking at the proportion of respondents. This is obesity, bisexual identity, and gender. And so before we saw no significant difference in each group, but when we do break down gay and lesbian respondents by gender, we do notice that gay men have the lowest proportion of obesity. Gay male respondents have the lowest proportion of obesity. Meanwhile, lesbian respondents have the highest proportion of obesity. And that is significantly different within that sexual identity. And this is looking at mood and anxiety disorders over age categories. And I think this one is particularly interesting when we look at bisexual respondents. They're significantly higher to report mood and anxiety disorder between the ages of 18 and 39. And bisexual or gay and lesbian respondents had significantly higher mood and anxiety disorder ages 40 to 49 compared to heterosexual counterparts. And I think it's important to note that bisexual respondents are approaching 50% of the responses. So now we'll look at some community resiliency indicators. Similar style, but now we're going to flip. So adverse is now going to be on the left and protective on the right. And it's a similar thing, both are compared to heterosexual counterparts. So when we look at community belonging, we saw no significant difference between heterosexual counterparts. But when we look at food security, unfortunately, we found that bisexual respondents had 63% fewer odds of reporting food security compared to their heterosexual counterparts. When we look at 4 or more people to confide in, gay and lesbian respondents were significantly more likely to have 4 or more people to confide in. Meanwhile, bisexual respondents were significantly less likely. And this one I really enjoy. It's the belief that you can impact municipal issues. And we asked this question for Vancouver respondents specifically. And gay and lesbian respondents had greater belief, significantly higher odds of believing that they can impact municipal issues. And I think that this is just a wonderful example of the activism within the community. And just looking at community resiliency, so this is going back to looking at 4 more people to confide in, broken down by age category. And I think it's interesting that at least among men, gay men had the highest proportion of 4 more people to confide in compared to both heterosexual as well as bisexual men. And bisexual men had the significantly lowest across all gender and sexual identities for number of people to confide in. So just reviewing just what we've talked about briefly. So again, we estimate that about 5.7% of the surveyed population identified as LGBT for about 133,000 individuals in the Lower Mainland. The majority of the LGBT population lives in Vancouver, where about 12% of the Vancouver population is LGBT. We did find that LGBT were more likely to report some adverse health behaviors, although there was no difference in physical activity and vegetable consumption. Now, while a greater proportion of LGBT respondents visited a healthcare provider in the past 12 months, significantly fewer have a family doctor or visit a physician with an appointment. So gay men reported the lowest rates of obesity compared to all other sexual orientations and genders, while lesbian women reported the highest rates. And LGBT respondents reported higher odds of mental health concerns, including mood and anxiety disorders. Gay and lesbian respondents were significantly more likely to report 4 more people to confide in, as well as greater belief that they can impact municipal issues. And finally, there is some indication that transgender people experience worse socioeconomic outcomes and healthcare access barriers compared to their non-transgender sexual minorities and non-LGBT populations. But unfortunately, with small sample size with transgender respondents, we weren't able to find largely significant associations, but we do think we are seeing some important trends that we need to further explore. So just to conclude then, the LGBT community in the survey region is experiencing a variety of health disparities that span lifestyle factors, chronic health, as well as healthcare access. And I think it's important to note that bisexual respondents often reported worse health and community resiliency outcomes compared to both their gay and lesbian heterosexual respondents. And so I think we can all agree that LGBT people should be included as a population of focus for health equity programs. And fortunately, it is, but we can always probably do more. And please let me know if we've left some of your programs out as well, because I think there is some wonderful work being done that is serving. This is specific programs that Vancouver Coastal Health is working with. So for example, the PRISM service, that I think is doing some really important work with healthcare access, transgender health information program, as well as call out to support LGBT youth in our community. And none of this can be done without the 1.5 years of work with all of these people to do My Health, My Community, as well as the countless surveyors that we had out in the field with iPads talking to anyone and everyone. So all of these people are to thank for this work. And if you have more interest in My Health, My Community, please visit myhealthmycommunity.org. We do neighborhood profiles. We have really cool atlases so you can compare your neighborhood with others throughout the Lower Mainland, which is fun. So please visit it. It's a good time. So thank you.